as an issue that cuts across every sustainable development goal. Health tells us how well we are delivering on our entire 2030 agenda, from ending poverty and tackling climate change to building safe and peaceful societies.
An equal chance in life demands equal access to health, yet half of humanity does not have access to essential health services. And the latest data shows that 2 billion people faced financial hardship due to the out-of-pocket health spending, including 344 million people living in extreme poverty.
These are not simply matters of health. These are fundamental issues of social justice, equity, and human rights. We can and must do better.
Ultimately, UHC is a choice, a political choice. But the choice is not just made on paper. It's made in budget decisions. It's made in policy decisions inside and outside the health sector. Most of all, it's made by investing in primary health care, which is the most inclusive, equitable, cost-effective and efficient path to universal health coverage.
We need really to strengthen health assistance as the #1 priority, and we need not only commitments, we also need investment and budget. This is the smartest way to be prepared for a next pandemic.
We really need to think out of the box and realign investments and explore innovations and tap other funding sources for health within the government system.
For this, we must listen to communities, including children, co-develop solutions and together keep track on progress.
We have a choice. Either we are the generation that saves lives and achieves universal health coverage, or we stand by and choose to let tragedy and inequalities continue.
Let's care enough to make sure everyone, irrespective of geography or economic status, has access to basic health care. If we care enough, we will find the will and resources to do so.
Imagine a world where health blooms, where every soul finds solace every hour. Imagine a world where wellness thrives, where new hope derives. Imagine a mother, a child's bright smile, dreams taking flight, nurtured. Imagine a girl, empowered and free, no pregnant boundaries to see. Her dreams take flight, so healthy she finds her way. Imagine a village, a city, clean and vibrant and strong. Through knowledge and care, lifting another to build prosperity. Imagine a world where disparities fade. Health as a bridge, Ubuntu, compassion, peace. It is this vision we promised. It is this promise we rather not forget. It's this vision we must achieve. A healthy, peaceful world for generations. A healthy, peaceful world. Imagine it today. My name is Dr. Githinji Gitahi. I am your moderator today. I am the Group CEO for Amref Health Africa, and I'm also the co-chair for the Strategy Advocacy Committee of the Partnership for Maternal and Child Health. Today's event is brought to us by PMNCH, UNICEF, and UHC 2030. And we are really glad to have you here. Please thank yourselves for showing up today. Please clap for yourselves. Many of you will be aware that a few months ago, a few weeks, we had the UN high-level meeting in New York that was actually looking at a second commitment, a second promise on UHC for everybody. But as we make these promises, the promise remains unfulfilled for 4.5 billion people. And 1.3 billion people are pushed into poverty every year. We have 800 women who die every day of pregnancy-related complications, and their rights remain a debate globally. Vaccination is sliding back. We've seen that. Teenage pregnancies, mental health remains unattended. Today, we are going to explore not only the promise, but how to achieve the promise. We are going to look at how do we move forward on this promise. And to do so, we have a perfect mix of panelists, and I'm going to start by calling my first two panelists up here for the conversation. And I'm going to start with the Excellency Svenja Shoes. How did I say that? Svenja, yes, please clap for me. Please. Please come on stage. Welcome. Thank you very much. And I would also like to call up here my friend Catherine Russell, who is the Executive Director of UNICEF and also the Sun Movement leader. Thank you. Welcome. So, all right. So, let's have a quick conversation about the action beyond the promises. As you've seen, we're saying that so many people have been promised better health. In many countries, majority have achieved. I don't think there's a country that still doesn't have people who can't access. But generally, we know that in our continent, in Africa, in Asia, in South America, the numbers are much bigger. In my own country, in my own continent, it's about 46% of people only who have actually access. So we need to discuss how to move this forward. And with me here, I have the best people to do this because I can tell you that between Minister Svenja and Catherine Russell, they have worked with two presidents or two chancellors. At least, so we have 4 presidencies here, or heads of government here with us. Yeah? I know that, of course, Svenja, as a politician, you've worked with previous governments. Angela Merkel, you've worked now with the current Olaf, the current chancellor. Russell, you worked actually with Biden, you're working with Biden, but before that you worked with my cousin Obama. You know, he comes from Kenya. So how many Kenyans are here? Yes, we all claim that Obama is our cousin. I see you, Professor. So let us have a conversation about your experiences. And the first thing I would like to probably ask Mr. Svenja is, within the fiscal space challenges that exist in other countries, you've worked in government, you've tried to make things work. In your view, how do you make the UHC declaration work for everybody, for women, girls, children, wherever they are, in distant places? How do we actually make this promise a reality in an equitable manner?
Thank you very much for that question. I think during the COVID-19 pandemic, everybody was aware how important a health system is, and that we need such systems around the world, that it is not enough having that in industrialized countries. We need to have that everywhere. It is a human right to have access to health systems, and we need to deliver on that. And I think that the UHC declaration, that was a really good sign. Our heads of state said, again, we want to deliver, we want that. And now we need to gather the money for it. That is the really hard work. And money is the first important step. But that is not enough. We need country-led solutions in every country. We need the engagement of every country. A panel before, we heard a lot from Liberia, from Senegal, from Malawi, what they are doing to enhance their systems and how important that is to do that in partnership and together. And these working together, getting the money together, but also having the right framework in every country. That is really important, and I'm still optimistic. We get steps forward. COVID pushed us back again, and now we need to go forward again, because it is right, and we need to do that for all the women, for all the children who have no access today to a health system.
Maybe I would like to hear a little more. What lessons, and I know there are people from different countries here. Germany is one of those countries that has made significant progress in UHC over the years, and your spend is obviously much higher, probably 5,000 euros or so per person per year, or around there. I may not have the exact figure. In many of the countries that we are working with, they are spending about $50 per person per year, or 40, 50 euro per person per year. And you've made a very important point that whereas money is important, it's the only thing. So what is it that you'd like to ask the countries to focus on as they make these promises a reality? Just maybe in 30 seconds only.
I think that the out-of-the-pocket healthcare payment, that is really a problem. That is a threat to a lot of people, because they need then their funding for health services, and that undermines all efforts to eradicate poverty. So we need to take care about healthcare systems, and we need to have more of that. And that is what we all try to bring forward, a systematic approach, a better service on the ground, with service for the normal people, that they get access, that women get access, that children get access. That is the task we have worldwide.
Thank you very much. Please give a big hand to the Minister. I think we have a lot to learn from you, from Germany. And later, if we get time, I would like to hear from you what you think the role of legislation is. Parliaments, so we'll come back to you on that. And of course, considering that now we're getting into a big debt crisis for most of these countries, which is also going to take us back, because it's going to further squeeze the fiscal space. But let me come to you, Catherine. You know, UNICEF is involved in these activities everywhere. You're involved in last mile delivery. During COVID-19, we worked with you in very many countries on delivering COVID vaccines to the last mile. But this work that you've been doing for a long time. So how does it look in what we need to do to realize universal health coverage for women, children, and adolescents, especially in extremely vulnerable situations? Conflict is increasing. We're having climate change disrupting communities. There's going to be water scarcity. Communities are moving. There is population change. So how do you think we are going to address all these challenges that are actually multiplying?
Well, you're right.
It's a simple question. It's a very simple question.
Yeah, very simple question. Yes. There are just innumerable problems, and the Minister and I were talking beforehand about how the list of problems keeps growing and nothing ever comes off the list. You know, it's just one thing after another, and because children are so reliant on government systems, they're very vulnerable to disruptions, whether it's climate or crisis or whatever it is. So, point one is it's very challenging out there for children. Point two is when we think about our work, we like to think about, you know, obviously from the perspective of a child, but I also like to think, and I say this often to donors, you know, imagine that we're talking about your children or children that you know. Like, what do you want for them? What do you demand for your own children? Well, you would want decent health care, right? Obviously, you want your children educated. You want to have all the basic sanitation, things that every child in the world deserves because they're human beings and because they have rights. So for us, we try to think about how best to do that. One of the things that we've learned in our decades of experience is that, you know, UNICEF works on the ground. We think that the primary health system is so important to get right. And as the Minister said, it's not easy to do that, excuse me, because, well, for a whole number of reasons, it's challenging. But we do know that we have to get it straight. And one of the interventions we've seen that has been so successful, and some of the ministers talked about it earlier, is these community health workers Why? Because they are on the ground. They are in the communities. They see what communities need, right? They can make sure that children are vaccinated. They can understand if there's sort of early warning signals for things like Ebola or COVID, right? They're invaluable in making sure that children get off to a good start. I was in India last week, and I spent some time with a community health worker who was amazing. And she was telling me that she has 1,000 families that she covers, just one person, but she knows all the families. I went with her to see a woman who had just had a child maybe about 5 months earlier. And she said she was with the woman throughout the pregnancy, so made sure she had vitamins and things. She was there when she delivered the child, and then she comes to check up and she does, basic measurements, height, weight. She also does cognitive work to see if the child is doing okay. That kind of intervention at that level, this woman probably never would have seen a healthcare professional, and no question that the child wouldn't have seen if they didn't have this, because people don't have the ability to go far to see this. So I think we know that this is a great intervention. We're excited to try to expand the numbers of community health workers. There's a lot that goes with it. They have to be trained properly. They have to be compensated. But when that happens, not only does it help the community, but it raises the status of these women in their communities as well. And so it's one of those interventions that is great on the gender equality side and fantastic on the healthcare side. So we're excited about it. And I have to say, just to Minister Schultz, it's so nice to be here with her. And she's such an advocate for children around the world. And so I want to thank her in front of all these people, because she is truly amazing. But it's really the support of everyone who comes together and says, children are a priority, and we're going to figure out how best to help them, and we're going to try to all do it together.
Thank you very much. And thank you. Are you seeing progress on this issue of community health worker investment by governments where you're working in the different countries? Because I know it's been, kind of half-hearted, one of those promises that actually is unmet. Are you seeing progress in the countries you're working in?
Yes, there's definitely progress. And it's interesting, they were talking earlier from, the ministers from Malawi and Ethiopia who have done some really important work. I think the challenge is for international agencies like us to try to help countries do it in a way that is really solid, which is to say, sometimes we see that the health workers aren't paid appropriately. They're kind of volunteers, or they get a tiny stipend. We need to make sure that they're essentially professionalized, right? That they get the training they need, that they have, we talk about it as a backpack, but the supplies they need when they go around and do their work, that they're supported. And I think the compensation is a big part of that. So we are looking at ways to help countries initially. Obviously, they have to transition into paying it themselves. You raised the point, which is exactly right, which is countries are just strained under the burden of debt, right? So it's not really that, they're not trying to do this, but sometimes it's a question for them, or do they, are they paying the service on the debt, or are they trying to educate children, or are they trying to provide health care? It's not easy. So we're trying to make sure that we can do the best we can to get them off to a good start. And ultimately, the countries have to see that it's worth it to them, that it's a priority for them. And I think when they see that it is the best way to start getting their primary health system set up, I think that we're going to get a lot of support from it from the countries. And again, that we will support the countries in that work.
Thank you very much, Catherine, because recently the Kenyan President, His Excellency William Ruto, launched the community health work. Now they have changed it to community health promoters. 100,000 for the country. Wow. Launched with a kit, with the nutrition tips and everything. And UNICEF has been a very useful partner and very great partner to this program. So thank you very much for the work you're doing in all the countries. On behalf of my country and all the countries that you're assisting, well done. Well done for that. Now let me come back to you on the political question, and then we'll close down. What do you think would be the role of parliamentarians in making sure these promises actually happen? Community health workers, for example, we talked about them, but the legislation frameworks don't work. UHC itself, after the declaration, we don't know how it then goes and sits in the country. So do you have any lessons from your parliamentary background on how parliamentarians can be part of this process?
I think for the parliamentarians in the countries who are affected by all the problems we just discussed, it is really hard to get fiscal space. So having international solidarity doing debt relief initiatives is really urgently needed. And we can provide a really good example. We have in Germany a debt to health mechanism that is the debt finance mechanism that we use through the global funds. That is really helpful, and it gives space for the ones who want to decide. And this kind of solidarity, easy to burden, help to make a system working, help to make the first steps to establish a healthcare system. That is really needed, and therefore we need the solidarity of the world, because the countries who have really hard burdens through the debt crisis, they need our support to do the right things.
Thank you very much. And we would like to thank you and your government for all the support in organized development aid. Germany is a big contributor to all the global health initiatives as well. Yeah. So thank you very much. And please give the two panelists a big hand. And as you walk out, because I'm not sure whether the minister is going to ask you to leave, we'll take a photo before she goes. So please, let's do that. Yes. Thank you very much. Thank you. Our next session is going to be with 4 panelists. So I would like to call them up here. I would like to call Dr. Juan Pablo Uribe. He is the Global Director for Health. Where is... oh, yes, you're right here. Yes, Pablo, welcome. Global Director for Health, Nutrition and Population, the World Bank, and Director of the Global Financing Facility for Women, Children, and Adolescents, who just finished a great replenishment just a few minutes ago. So congratulations, Pablo. And I know you're going to achieve your replenishment goal. Second, I would like to ask Gabriela Cuevas-Baron. Gabriela is the co-chair for UHG 2030 Steering Committee. Welcome, Gabriela. Good to have you here. And I would like to ask Dr. Omnia El Omrani. Dr. Omrani is Youth Envoy to the Presidency of the UN 27th Climate Change Conference. You know, when I used to watch your envoy work, and I said, when I grow up, I want to be like Omnia. And now they have appointed me Health Envoy to the COP28 for climate change and health. So you've inspired me a lot. And then Kevin Ali, please come up, CEO Organon, an organization that has been working in the area of delivering innovation for women's health every day. So welcome. And finally, I would like to ask Lois Pace, Assistant Secretary for Global Affairs, Department of Health and Human Services at United States of America. Welcome, Lois. So now, please find your label and sit next to it. Yes? Good. Thank you. Excellent. Good. I have committed myself at every session at WHS to celebrate every panel that has gender balance and diversity. So let's celebrate this panel and the one that was there before. And so thank you very much. We've come a long way in getting actually representation of women on panels. You remember we have had to fight to end panels, and it looks like at the World Health Assembly or the World Health Summit, it's actually a thing of the past, isn't it? Good. Indeed. So congratulations to all the organizers. And I see that Rupa is here smiling because she's been part of this battle. Now, let's go straight to this conversation. You've just heard from both Venia and Catherine on the challenges of meeting the promise, but what is going on, and also you've had hope. I think what we talked about is also hope. It's not all gloom. So let me come to you, Pablo. Let's start with you on this side, because the GFF has been part of this journey. We know in the countries we work that GFF is doing a lot of work on maternal health, family planning, adolescent health. But how does the World Bank ensure that in your working with these countries, because it's a mix, you have granting and IDA and all these things, how do you embed equity in that work? How do you ensure that equity is at the center of your work with the countries?
So, Gitinji, thanks so much. And I want to of course, thank UNICEF, the UHC 2030 Partnership, and PMNCH for thinking of a space as important as this. I would say that of all the health policy discussions in which I may participate in a year, I think that this one about UHC is the most important, because it really covers all what we want to do in many of the more particular and granular aspects of our health expectations. And unfortunately, we're not doing well. Some people may say it was COVID, but it was not COVID. Before COVID, we were not doing so well as well. And as you've seen in the Global Monitoring Report put out by WHO and the World Bank, we're doing, in many countries, we're going back in terms of access to essential health services and in terms of financial protection and out-of-pocket expenditures, which really hurts families and their livelihoods, especially the poorest. So, in that context, of course, financing is critical, and the World Bank is a very important instrument for strengthening the financing of the health systems. We try to do it always working through governments. And yes, that's a choice. Many times it's difficult, but when it's difficult, it only implies one additional step. If the systems are not in place, then you need to work in putting the systems in place. But the only way in which we will achieve UHC, and by the way, long-term sustainability of better health, is by helping the countries really lead the strengthening of their health systems. I would say, quickly, let me go into a couple of more detailed things. I'm seeing with a little bit of surprise that in many of the countries, we're not engaging in the most difficult discussions. Of course, there's graduality in the maturity of policies, but we need to start, and it was said by the panelists before, that we need to discuss risk pooling and health insurance mechanisms. We need to go back to that. I'm sorry. You will not have financial protection if you don't address the technical and the political challenges of risk pooling, getting money together and putting it above and beyond the families and their own individual needs, so that whenever they have those needs, that money can come to help them. We need to do much more in strategic purchasing. We need to work around the payment mechanisms and the accountability. We need to discuss, again, the health benefit packages and how to prioritize, again, in graduality. We need to have frontal discussions on taxation in our countries. All of this because we need to increase public health investment in our systems. Without a bigger chunk of public health spending, it's going to be very difficult, really, to advance UHC. And all of this has to come with a strong equity lens. It has to be really intentional in closing the gaps of inequity in our countries. But I want to conclude with saying something a little bit beyond the discussion that we generally have here. And it's, I was listening to DJ Tedros in his speech, and I fully agree with him. UHC is a political choice. But it's a political choice that has to be sustained through different governance as an ambition, a longer-term vision that a society wants to have. This is extremely important. Second, sorry to say it, but you all know it, UHC is not created or built or constructed in short term. It has to be a long-term effort. It takes many years to build a strong health system that really delivers universal health coverage for everybody. It takes very limited time to destroy one that does that. Third, and as was said also before, it has to start in primary health care. It has to start in community health. However, it will not end there. And I think it's also important to anticipate that universal health coverage will need to construct on primary health care and go beyond that. And that's a big challenge, in particular for middle-income countries like mine. Fourth, it requires this continuous strengthening of the system and its processes and its institutional capacity and its leadership. Without those, by the way, we don't make things happen in our country. We need strong leadership, institutions, systems, processes, so that things take place at the subnational level where the people are. And finally, financing is key, Githingi. But if financing was the solution, I would be even more optimistic. Financing is a must, but it's not enough, again. So let's keep that in mind, and again, let's address the universal in health coverage with the complexity that the effort really implies, so that we can succeed in building it in the longer term. Thanks.
Thank you very much, Pablo. And of course, bringing in the very experience that you also had as Minister of Health and Social Secretary in Colombia. So I can feel that through your conversation, that you're speaking from experience. And in the continent where we come from, the people have the hardest job as the Ministers of Health, because they have to work with so little money to do all these things you're talking about. And maybe I'll come to Lois. Then and the reason I want to come to you, Lois, is Pablo talked about the UHC benefit package. Mm-hmm. And within that universal health coverage benefit package, there are always debates about what should be in it. And it's a political choice. There's also a social choice. People are also fighting. Everyone wants to be in the package. Mm-hmm. But the area of sexual reproductive health and rights is an area that often gets debate about, is it really an area we should finance? Should it be in the benefit package specifically? It is seen as something that is, in many countries, like dispensable, because it's, it's not urgent, It's not like pneumonia. You have to treat the child at that point. So maybe from your point of view, why do you think that sexual reproductive health and rights needs to be in this benefit package? And how do we achieve that? And why is it so important to invest in women and adolescents, and especially in the area of SIHR?
Well, I can appreciate your framing of this question, Githinji, because I've talked about UHC and how so many people want to put mini ornaments on this tree, if we think about the Christmas holiday. Some of us might think that SRHR should be the star on that tree, or at least, a featured ornament. And that's really because when you think about it, and you think about this from the perspective of people who need to access these services, they don't really have a choice but to require them, right? So it's not optional, it's not even negotiable for a lot of people who have that need, who have that requirement. And it's also because it's not limited to what I think people generally think of when they think of sexual reproductive health and rights. Really, if we're being honest, people usually just think, oh, this is about having babies. And other times people might say, oh, this is about abortion care, right? But the spectrum of what's included in SRHR is so much broader and actually needs to be expanded beyond what we have imagined and even delivered to date, right? And we had a really, I think, important session and conversation about this a little bit earlier, where people talked about the importance of remembering the sexual in sexual reproductive health and rights, where people talked about the importance of life course and what it means to be someone who requires these services from beginning to end, right? Think about women in menopause, and we talk about an aging population around the world, and yet this isn't really a part of the global conversation. And so when you ask whether we really need to cover SRHR as part of UHC, it's hard on this panel of other women, right, who presumably also take advantage of these services, to say no. I think that also came through in the high-level meeting, importantly, and it was really great to hear a lot of what was said from the floor of the UN by leaders, right, including our Secretary of Health, to say, look, we cannot talk about UHC without talking about sexual reproductive health and rights. And don't get me wrong, it's not the only thing that women need, right? Women also need access to services for non-communicable diseases. Women also require specific services regarding mental health. We are left behind in multiple areas, and women will tell you that it's not just about this one particular space, even though we want to broaden that space. But importantly, ministers took their 2-3 minutes to talk about SRHR because they know that it's core to delivering on this goal.
Wow, fantastic. Thank you very much. So please, saying that it has to be at the center. And again, now I'm going to come to Gabriela because of the political weight of these statements that you're making here, because I know there has been a lot of division. I've seen countries that have actually even released statements saying you can't put sexual and rights in the same statement in policy documents, and these are governments. Now, there is, Gabriela, you're leading a multi-stakeholder group, UHC 2030. You have been in parliamentary politics before yourself. You're actually a parliamentary politician, like the minister who was here with us before. What do you see as the role of politicians in embedding the sustainability that Pablo talked about? He said, UHC commitments need to be multi-government, multi-year. We see in many countries that every government comes and changes, and therefore says, our approach is different. We are not like that other person who was there before. We are better. So it keeps changing, and then I get momentum. So how do we actually use political leadership that was referred to earlier to understand these matters and to embed them in law? What is your experience in this area? And then I'm going to come to you, Kevin, because in your company, you actually manufacture and avail or make accessible hormone replacement therapy medications in addition to family planning technologies. True? Lois raised a very important point that actually we see sexual reproductive health and rights as very limited to family planning. I would like to hear your experience on these areas, whether actually governments are covering them, whether you are getting success in actually them being recognized as medicines which people have a right to access, or are we only limiting these things to family planning? You may not have been prepared for that question, but it came up when Luis was speaking. So, but you are ready for it. You are born ready, I can see. So over to you, Gabriela.
Thank you. Thank you very much to the organizers, and thank you, Gitingi. It is a pleasure to be here with all of you. UHC, yes, it is a matter of political will, but especially about political determination. Yeah. We have had 2 political declarations adopted at the United Nations, and we know the numbers. Half of the world's population has no access to essential health services. So we need to understand that health is a human right. It cannot be seen as a privilege. And that's where governments are the most important key for implementing UHC. Yes, governments alone cannot do that, but they have to lead the efforts. I am sure that implementing UHC is possible if there is political will. The first part is to place people at the center of all decisions. Second, then we go to governments, but
yes,
especially...
she is clapping to putting people at the center.
Thank you.
So, thank you. Yes.
Once we understand that people are the important element here, then we go not only to governments, but to parliaments, because parliaments have very important responsibilities. Sometimes we see them like an ex of the government. But it goes to the parliament, for example, in terms of legislation, to be sure that no one is going to be left behind. And here I mean to establish at the constitutional level the human right to universal health. And as the title says, we cannot forget that part of universality, and that goes to Parliament. The second part goes, as Juan Pablo was mentioning, to financing. But yeah, we are all aware that the world is struggling with the finances. But then parliamentarians are responsible of making a choice. And sometimes they have to decide about investing in wars and defense, and choosing about their own people, choosing about health and education, choosing about the long-term solutions, and that is well-being. And here, of course, women and girls have to take a very special place. To be clear about parliamentarians, 2 billion women and girls are still being discriminated by their own national law. That is something that we cannot accept simply. Then we go to governments. Yes, governments need to develop a strategy, to have targets, to have timelines, to have a real implementation process. If we want to build the bridge between these international commitments, these lovely political declarations, and realities, what people is feeling and suffering, then we need governments to take their responsibility. And here, of course, primary health care is a must. Yes, it is not the whole system, of course, but that's the foundation for starting with communities, for education, for prevention, and of course, something I believe that is very important, and I can say that as a former politician, that is the way to rebuild public trust. We lost that during the pandemic. We not only lost a lot of lives, we also lost trust and community fabrics. Here I would like to mention the health and care workforce. For all that are here, my humble gratitude. But also we have a huge concern for the underrepresentation at leadership positions and the 24% gender pay gap. And there's another key ingredient, just to finish my participation, but we need to consider other stakeholders that are very important for making UHC a reality. First, civil society. That's the way to approach communities. That's the way to go to vulnerable groups. Yep. We need to understand that civil society is not a political opposition. They are civil society. Yep. They are true heroes that are raising their own money, that are working perhaps with the most marginalized groups of society. There is also the private sector with research and development. They are part of the health system. They deliver services. And of course, they can also mainstream equity in their business models. There are the international organizations, academia, media. And they are all very important. I am only rushing because of time, but not because of importance, because they can be very helpful in terms of accountability. When we are saying that we have fiscal limitations, then we have to ask all these stakeholders about making us accountable, about making governments accountable, because perhaps there is a lot of room for having money for people in need. So I am sure that we can build the bridge between international commitments and local realities. But political will, political determination is a must. And we need to choose. If we are going to be the generation that is capable of achieving UHC, or we are going to be that generation with business as usual that just get rid of a pandemic with awful results. It is our choice, and I truly hope that we choose to make UHC a reality for all.
Thank you. Thank you very much. And let's get to private sector then. I was about to ask you whether you think we are making progress on UHC in the countries, Gabriela, but I'll come back to that later. So, Kevin, the multi-stakeholder approach that has been talked about by Gabriela and and as well Pablo and the introduction of laws and how health is not a singular department, it's actually the entire society. So private sector is at the center of it. And many people don't understand private sector. Many people think that private sector, when you engage in private sector, is how much money do they have to give you. People think it's actually private sector should contribute money. But we saw throughout the COVID pandemic, it's private sector that actually delivered the innovations that were life-saving. The question that we always have around the private sector, and I was actually co-chair of UHC 2030 before, and the question we always got was equity. How does private sector in its contribution ensure there is equity? Because business is good, profits are good. How do you ensure that actually as you serve and as you make profits and as you grow business, employ people, that there is equity at the center? So maybe you can comment on this and also maybe comment on the earlier question on hormone replacement therapy and the continuing, not just HRTs, but the entire spectrum of sexual reproductive health and rights innovations for women. Over to you.
Thank you. That's a long question. Yes. I would say that I am here, I feel kind of surrounded in a sense, as a representative of the private sector, as you call it, as the CEO of Organon, which is a company only 2 years old, but we're a global company that is a spin-off from a much larger company. Yeah. And at the time that we spun the company off, we have many different businesses across the world, but what was our purpose? Where did we want to focus? And essentially, we decided that the path going forward, the vision of the future, is about how can we address women's health as an area of innovation. Because we've recognized that there were significant gaps in the treatment of women's health-related issues. If I may just give you a few kind of things that were very provocative for us, stunning for us in terms of the statistics. When you think about unintended pregnancies, globally, 5 out of every 10 pregnancies were not meant to be, were not intended. Now, that can actually be a blessing for some, and it can derail other women into areas where they are no longer able to pursue their economic viability or their education or anything in terms of their future planning. When I look at things like endometriosis or polycystic ovary syndrome, let's take polycystic ovary syndrome. It affects nearly 8 to 13% of all women, and that's about the same rate as diabetes, by the way. Not one innovation currently on the market for the treatment of polycystic ovary syndrome, which has metabolic issues that a woman has to deal with. Endometriosis, it's a very painful condition. It affects almost 9 to 10% of women in essentially in their reproductive age. And there's only been one innovation over the last 10 years. So we saw that there was a need, and ultimately when you look at the WHO, they've signaled that women in general have 20% more feeling ill than men throughout their lifetimes. And women's issues around these issues I've just talked about, in terms of diagnosis and recognition, is far, far worse for women throughout their lifetime. So as a result of that, we saw a need of investment in R&D. And if I can just take you through in terms of a couple of examples of what innovation in research and development can offer the world, think about cervical cancer, human papillomavirus, which is a sexually transmitted virus, is essentially responsible for a large degree of cervical cancer in the world. Just the HPV vaccine alone can address 90% of all HPV strains. And so as a result of that, the WHO even has signaled that they see a world in the future, a goal of eradicating cervical cancer due to HPV. An area we're into, which is postpartum hemorrhage. It affects essentially 1 to 2 women die every 3 to 4 minutes around the world from abnormal bleeding during the delivery of children. There hasn't been any innovation. So we actually developed a device that we've launched in the US now. We'll be launching in Europe. It's called the JADA device that can significantly help very quickly to resolve the issue of postpartum hemorrhage, which again is a major issue that needs innovation. So there's tremendous opportunities for investments, but you, my colleagues here, have pointed out that there needs to be essentially the other side of the coin is access. From a business person, we're not going to make investments in R&D if the R&D is never given access, that innovation is never given access to patients to treat. So there has to be the other side of the coin, which means, as was stated, there has to be essentially funding. There has to be an opportunity that ultimately we can work with governments in order to bring some of these innovations to public so that they can be used. In essence, if there isn't the access, then the R&D will ultimately dry up and we'll continue to go back to that vicious cycle of no investments in women's health. And to that end, we've actually looked at, for example, unintended pregnancies. We at Organon have a program called Her Promises, Her Power, and we work with groups like the UNFPA, we work with local governments to reduce unintended pregnancies by 120 million less unintended pregnancies by 2030. We're halfway there, but we have to work with partnerships. Partnerships are critical with NGOs, with government agencies in order to be able to address some of these significant issues that affect women across the world. And really when we do those things, we can then ultimately affect, and the only way we can talk to governments is to say, these are the economic benefits that accrue to you if you're able to address women's health issues in a more holistic ecosystem that ultimately provides innovation to women.
Fantastic. It sounds like there's a lot of innovation that's actually coming up that's addressing real issues there. So the question remains about how to ensure, because even when you talk about the innovation on PPH, you say it roll out in the US, it's going to Europe. How fast does it get to Malawi? How fast does it get to Chad? How fast does it get to those areas where the need is so high? And that's the gap we all have to close. I don't think it's the private sector's problem alone. It's about all of us getting together and saying, how do we scale innovation? So let me hear from Omnia, from listening to all these policymakers, and private sector. What do you think as a young person about the success issue, equity, and how to actually deliver it faster, the need for speed, and to make sure that the woman who is likely to die in the next 3 minutes because of bleeding, actually we save the next one, and we don't keep having those 3-minute deaths every day. So,
first of all, thank you so much for having me, and I was very inspired by the diversity of perspectives. I brought in a very important thing, which is equity. And what I see now is the need of centering different agendas, whether it is the SRHR agenda or the adolescent health and well-being agenda or the NCD's agenda. But at the same time, when we think about equity, we need to center the needs of the most vulnerable groups and then tailor according to their needs the solutions with the urgency, which is very important, the element of urgency. And as a young person, I always feel a personal responsibility to the children and the adolescents that are shouldering the impacts of the current challenges that we are facing. And at the same time, it is not just affecting their health, it is affecting their basic needs and rights. The right to food, the right to water, the right to air, to healthcare, to education. And when we're thinking about universal health coverage, how can we make it adaptable to the challenges that are now becoming unprecedented every single day? And I know that because of the reports that we are seeing right now being released, and it's important to recognize how UNICEF, for example, look at these numbers that we're seeing. We know that right now, 1 out of 5 children lack basic access to safe drinking water. We know that another report recently published right before COP27, that a child born today compared to a person born in 1960 are going to see from 3 to 7 times the rate of climate disasters, which is also impacting their health and their well-being. And it's also disproportionately affecting women and girls. We know that climate migrants, 80% of them are women and girls. And we're seeing how people are being displaced not just by climate, by conflict, by both together, and disproportionately across all regions. So equity is so important, and I can argue that it is more important or as important as innovation, for example, because I see a lot of focus, especially by the private sector, by funders, by different institutions. How can we invest in innovative technologies? How can we look at digital health and digitalization of systems? But at the same time, yes, it's important to invest in this because it provides better quality of care for healthcare services, but how can we make sure that these technologies and innovations reach the most affected the fastest? And this is where the equity element comes from. And at the same time, we also need to recognize the importance of the right to health and what that means. And I recently wrote a commentary with a group of young professionals from different sectors. We had a young lawyer, a young activist, a young policy maker working for PMNCH, and I was coming in as a young doctor. And we decided to come together to look and to understand what does it mean a right to health, and how can young people implement a human rights-based approach to their health, and what are the different lenses that we need to look through, and what has already been done around that. We looked at participation, we looked at accountability, We looked at equity and non-discrimination. And the last thing we looked at was transparency. And just to quickly reflect on what that means, we know that many young people are now holding their governments accountable through litigation. And their right to a healthy future and to an equitable healthcare that they deserve. We also looked at participation and what it means when it comes to the spaces that we are part of and how we're seen not as add-ons, but as equal stakeholders with our own diverse voices and perspectives. And then the final thing that we looked at is how can we translate the actions that many of us are doing into policy. And this is why it was so amazing to see throughout the whole year the 1.8 billion campaign that was done by PMNCH. It was only 2 weeks ago where there was the Global Forum on Adolescent. An action agenda has been launched. But the challenge now is how can we combine this agenda with the women's health agenda, with the climate agenda, and how can we center them without occupying space from one another, but actually looking at centering the voices, the needs, and the solutions that can be tailored according to the needs of the most vulnerable communities at the heart of the global health agenda, the political forums that we are organizing, and universal health coverage. How can we make sure that UHC is actually based on the needs, on the insights, on the data, but also on the lived experiences of those who are being affected the most?
Fantastic. Centering UHC on the people and the most affected. We have a few minutes, so I want to ask for 3 questions only, then get the panelists to respond before we start to wrap up. Anyone with a burning question, and if you have a panelist to go for it, please say which the panelist is. Any comment, question? And is there a mic? Okay, good. No question, no comment. None. So, yes, you want to say something? You agree with everything they say? Is there a mic? Is there a mic somewhere? No? Okay, I'll come close to you so that they hear what you're saying.
We agreed to whatever they said, and we want to see it as a reality in our countries. Changes. Back home. So that is what we want.
Excellent. Thank you very much. She says she agrees with everything you say, but they want to see it as a reality in their countries. So then, as we close then, as we come towards the end of this panel, then the question is, how do we make all the things we've said a reality in the countries? We are all sitting, each of us here comes from a particular country. You come from a country and you want to see that reality that Omni has talked about, reaching the most vulnerable, the farthest, fastest. So I will ask each of you to comment on this question of how do we make this a reality, practically? Let's start with you, Pablo.
So I think that's the biggest challenge that we all have. We always come together and have very good discussions, and we also produce a lot of knowledge, a lot of technical inputs, etc. But at the end of the day, it's at the country level where things need to change. And again, I would insist in really understanding how governments work, how ministries work, in having intentional focus on subnational governments. Countries are not homogeneous. And knowing that reality, that political economy, that political reality, coming together, all of us, from our different competencies, from our different skills, around the country leadership to make change happen. And by the way, change has been happening. It's not that it never happens. There are a lot of very good cases. I came last night from Marrakesh, where the bank was having the annual meetings and committed to a big transformation, by the way, in terms of global challenges and its leverage capacity and also its agility. But I was so impressed seeing how, for example, Morocco has decided that human capital is a must, and they are implementing, in a very short time frame, a mandatory health insurance for everybody in the country. I was in Laos seeing how some of us. Different institutions can come together at the country level to make things happening. You're seeing the transformation in Indonesia with a lot of different angles happening at the same time to move the whole system forward. So I just wanted to say it does happen. We need to be optimistic, but it's at the country level coming together, not competing among us, but joining forces around country leadership.
Thank you very much. So country leadership getting together and led by countries. Thank you very much, Pablo. Yes. And so over to you, Gabriela.
Well, again, we already adopted 2 political declarations. Yes. The roadmap is absolutely clear. Then we need, from the government side, parliaments, local governments, etc., political determination. It's about leadership. It's about political will. But also from the people's side, from civil society, from academia, from all different stakeholders, I think the most important part is accountability. As a former politician, I am always questioning myself, why is it that some governments that had terrible results during the pandemic are still popular? That's a problem that we have as societies. It's a problem in terms of accountability, in terms of transparency. Politics is about having results. It's about giving solutions to the people that you represent. It is not about egos. It is not only about being popular. It is about responsibility. So I truly believe in that. From one side, the responsibility of those governments and parliaments and all public sector, but on the other hand, the responsibility that we should have as citizens in all the different spheres. But we need to make governments accountable. We cannot continue with business as usual. We need to make that choice. It's our choice.
Thank you very much, Gabriela. Kevin.
Well, I would say that our focus in terms of Organon is that we want to draw attention to the fact that we need to redefine women's health. Historically, it's always been defined as reproductive health, sexual and reproductive health, fertility on one side and contraception on the other side. But I've discussed and detailed so many unmet needs that are equally or even more devastating. If I think about preeclampsia, for example, that affects women of color mostly, in terms of the highest mortality associated with giving birth and being pregnant. And so there's so much that is required in R&D because innovation ultimately along the spectrum from reproductive health. So for example, in some countries in Asia, whether it's China, Japan, Korea, they're very focused on their demographics and trying to reverse the demographic trend so that they ultimately don't have a situation where they have, essentially half of the population they have today by the end of the century. So they're focused on that, where other countries in Asia, for example, are focused on contraception because of the unintended pregnancy rate. But globally, what we want to do is draw attention to so many other needs in a holistic view of women's health. And this is not cheap. It's not cheap on the private industry sector because in my area, it's a very high risk that you never cross the line with a viable product, but you have to invest. It has to be the same thing that governments understand, that a healthier economy provides better economic prospects for the future. If you think about women, provide essentially 60% of all the essential healthcare in the world. A healthier women's health, a healthier population of women throughout the world will have a multiplier effect, not only in terms of women's health, but their communities and their economies. And ultimately, that's what we need to do to provide that sustainable financing ultimately for governments to invest in women's health beyond just reproductive health.
Thank you very much. Lois.
Well, I'm inspired by all I'm hearing. What really came to mind for me hearing this question is how we can play more offense than defense. I think particularly in the US context, since you're asking about our countries, there's so much time we spend making the case for why something like UHC is important and essential, whether that's with Congress or in the courts. But, you know, recently, we've really adopted, I think, a much more offensive stance and said unapologetically, we are going to pursue this because people require it to be healthy and whole. So whether it is for the first time negotiating the price of drugs for the country of our size with the vast medical system that we have, or, yes, thank you for that applause, I'm certainly happy about it. Or, you know, looking at some of the issues Kevin raised, right? For the first time, again, we have our what currently exists as universal health coverage in our country now actually covering something like postpartum care for 12 months after childbirth. And this is especially important for women who look like me, who do have a higher risk of dying because of childbirth. Not a baby increase in risk, right? We're talking about 3 and 4 times. And then further, when we come back to SRHR and we think about not just contraception, but privacy, right? Or gender-affirming care. You know, we're really trying to do more than just protect the space that we've gained over time, but really push those borders out even farther. And it's a tough time to do that, but I think the only way we can truly realize UHC is by standing firm, holding the line, and being that much more progressive and assertive in what we advance.
Fantastic. And finally, Omnia, wrap it up for us.
Yeah, but I really love what he said, and I think my answer to that would be, I see that when we think about what does that mean in reality, we think about our community, and we think about what they would need. And we know that essentially one of the greatest barriers to many civil society organizations, youth-led groups, as well as community health workers is funding, getting the necessary funding to translate all these efforts, even to do research or to help the community or improve women's health as well as the health of children and adolescents. We need funding, and not just to give us micro grants, but to also provide capacity building on how to sustain the actions that we're doing, how to increase them, how to further reach these communities that do not get that access to the services or to the technologies that they need. And this is at the local level, but if we look at the national level, at the country level, if I'm looking at my country, Egypt, I also think that it's important for the policy spaces to be reoriented to include the voices of the people who are at the front line, on the ground with the communities, translate these insights, these stories back to the policy level to really create policies that are delivering with the people and for them. And this is very important when we look at the true integration, or so that we can confidently say that our policies are equitable, they are responding to the needs of our people, and they're not leaving anyone behind, as we always say. And it's important to listen to our communities and to make sure that when we listen to them, we also value and respect their time and their efforts, and make sure that the policies and the financial facilities and the actions that we are doing is truly tailored according to their needs. And this is my final message to that.
Excellent. Thank you so much. And to sum it up, country leadership with accountability and responsibility, redefining and making sure that science addresses the emerging needs, making sure that we are focusing on people who are healthy and whole, and finally putting people and communities at the center so that our responses, our policies, our programming, and our strategies, and actually our execution is people-centered, led by communities. Thank you very much. Omnia, Lois, Kevin, Gabriela, and Joan, thank you. And of course, Catherine Razel is here, and the minister from Germany. Thank you very much. Thank you.